Hello, everyone. It's my great pleasure to speak on behalf of our team in the treatment of COVID-19. We would like to share our experience in the treatment of COVID-19 using Chinese medicine. So today my topic is protecting vulnerable population from acute lung injury. So it's about the COVID-19 treatment. So my name is GuangXi Li. I'm from China Academy of Chinese Medical Science, Guang'an Hospital. So it's my great pleasure to meet you here online. Let me share my screen so you can see it more clearly. Okay. So I will discuss several things about the COVID-19 treatment. So the first, the symptom of COVID-19. The second, treatment of COVID-19. The third part is the cases of treating COVID-19. And I will do some summary. And if you have any questions, you may ask me or email me. So regarding the symptom of COVID-19, maybe many of you already know that. So the main clinical manifestations include fever, fatigue, and dry coughing. They usually did not come out at the same time. So the less common manifestations include stuffy nose, runny nose, pharyngia, and diarrhea. About 10% of the patients will develop dyspnea and hypoxemia around 1 week. So in severe cases, they can rapidly progress to ARDS. So that means they will develop acute respiratory distress syndrome, and they may even develop septic shock, metabolic acidosis, and increase the blood viscosity and coagulation dysfunctions. So the COVID-19, some people, they call this disease as a silent killer. So one of the most notable features of COVID-19 is that it goes unnoticed for a remarkably prolonged period of time, like, maybe around 1 week, running a course of a mild or uncomplicated illness for weeks until sudden and severe symptoms develop in a subgroup patients, requiring hospitalization, oxygen support, and further support from an intensive care unit. So who are the most vulnerable population for acute lung injury? So there are several things you may know. The first major part is male. So compared to female, male population have more possibility to develop acute lung injury. And another important thing, risk factor, is overweight. And third is diabetes, and the fourth is they may have some other baseline conditions like hypertension, like chronic kidney deficiency, and some other disease or cancer. So those populations, they are vulnerable populations. They may have more chance to develop acute lung injury. So since most patients, they only have very mild symptoms, maybe for the kids, for the young generation, they may even not have any symptoms. They are asymptomatic patients. So, but the treatment, the key treatment of COVID-19 is to save these people from the COVID-19 attack. So here is some data we have done some statistics. So from this data, you can see the overweight is one of the most important risk factor for the acute lung injury. So regarding the acute lung injury, we must know how the symptom progress over the several days. So the patients usually have some incubation period. It's about 1 to 14 days, and mostly they are 3 to 7 days. And fever period, that's if they have symptoms, they may have 1 week, fever. If you treat that on time, the fever can gone easily. So this is good window to prevent the acute lung injury. So the other part, if once they really develop acute lung injury, then they need some kind of respiratory support, and they need some mechanical ventilation. And after that, the recovery time is very, very long, and they may have many, many symptoms after the acute lung injury. So that's a very important picture we have seen in the past 1 year. Once the patients have the COVID-19, they first, if they stay at home, like in the first several days, they did some home isolation, stay at home. Usually it's just like influenza, and they may not develop a severe cough or severe dyspnea. But for the vulnerable population, it's very dangerous. They may progress very quickly, and they start to have high temperature. Their cough become worse and worse, and they start to develop dyspnea, and they need to go to the hospital emergency room. And further, they need respiratory support and end up in ICU. So it's a very, very painful process. So the major time window for us to prevent acute lung injury is the first 48 hours, or even maybe the first several days. So that's the most important time window for us to treat patients, to prevent they develop acute lung injury, to prevent they died from the ICU. So that's a very interesting paper published in 2020, and here we can clearly see it's not only viral, replication kill the people. The most important why they develop severe respiratory failure is because of host inflammatory response. So they trigger the viral infection actually triggers the host inflammatory response, and then develop a severe ARDS. So that's the most important. That's the important mechanism of the patients who suffer from the acute respiratory failure. So how we treat COVID-19 in the very early stage, we usually do the control transmission. So we isolate patients, we do the test, we isolate all the patients, and they may, those patients, can be quarantined and not affect other people, especially we protect vulnerable population through this control, cut the transmission line. It's usually like that what happened recently in India. So how we stop the transmission, we must do the lockdown and to protect vulnerable population. So regarding the treatment right now, we don't have a good treatment using the conventional medicine. What we can only do maybe is to do the vaccination, but the vaccination usually takes quite a long time. So right now we don't have the ready worked antiviral drugs, or the fever reducer. These some physicians try to use the steroids, NSAIDs, to treat the fever, but it's using according to our experience, it did not work so well. So maybe the best medicine we have tried is Chinese medicine. So that's let's move to the second part, is the treatment of COVID-19. So regarding the acute lung injury prevention, that's my major research focus. So for the people, if they are very healthy in the baseline, they don't have any other baseline conditions, you can use quite a lot of different Chinese medicine combination. Maybe you already know some of the we call that three herbal medication and three decoction. We use that to treat the regular symptoms. But for the vulnerable population, how we treat? So these patients, they really are the high risk to develop acute lung injury. So according to Chinese medicine theory, those patients belong to the qi deficiency. So what we need to do is to boost the qi to treat the patient, to reduce the fever. So that's the most important drug, herb, is ginseng. So we call that ginseng and mantif formula. Here, that's a major Chinese medicine we have used for 1,000 years to treat pandemic influenza. So these are all the medication name. You can read it. You can check that from the internet. Maybe some of the herb you have that in your country. So the key role of ginseng is why it's so important, because it's in Chinese medicine theory, those patients, vulnerable population, they belong to the qi deficiency. So the disease, the COVID-19, the virus can kill you because you are deficiency. You don't have enough qi to boost you to the other stage to reduce the fever. So that's how we use ginseng to protect the vulnerable population. So ginseng, the major component of ginseng is ginsenosides. So the soul of ginseng detoxification powder formula could be used to prevent and treat a variety of inflammatory disease via anti-inflammatory functions. So the TCM practice suggests the key mechanism of ginseng is immunoregulation. So basically, they regulate our immune function to adapt to this new virus and not trigger the cytokine storm. So in the history, we have used this formula. We call that 人参败毒散. So for 1,000 years. So it was originally recorded in the prescription of the Bureau of Taiping People's Welfare Pharmacy. That's in 1078 that year. So the later commentary by Yu Lin and some other physicians, Chinese physicians, stating that it's the best formula for treating pandemic influenza. So the history of this formula has been well documented in the Chinese history. So in the Qing Dynasty and Ming Dynasty, there are several pandemic influenza. So we all use this formula to treat the patients, especially for the vulnerable population, and nobody died from the pandemic influenza. So that's how we record it in the medical history, medical book. So the ginseng formula, and later, if the patient don't have the qi deficiency, they may use a mentor formula. So that's how the formula change over time, and according to different patients have different baseline conditions. So this formula is very successful in the prevention of acute lung injury. It has a strong curative, strong effect for early stage pandemic. So this formula, we should not use it at the late stage. Like if the patient really develop a severe acute lung injury, then we use this formula, it may not work so well. But if we use it very early stage, it's really worked very well. So I would like to give several cases of how we treating the COVID-19 using this formula. So here, this patient is a male 52 years old. They had diabetes or OSAS, and he actually was quite a late stage. So he was on the moxifloxacin for IV for 8 days and the methylprednisolone for 8 days, but it doesn't work. The fever increases from the 37.8 Celsius to 39.5 Celsius. And the patient start to have coughing, shortness of breath, and desaturation. So here you can see physical examination, and what initially you can see at the oxygen FiO2 is about 65% FiO2, and the patient's SpO2 is only 81%. So clearly the patient developed acute lung injury, and so they start to have fever. So it's very key stage here, right, very close to the cliff. So how we save the patient's life? We use this formula, ginseng formula, and we reduce the fever without rebound. So you can see at the FiO2 43, and the patient's the saturation can reach 97%. And later on, we use some transdermal therapy to treat the patient's alveolar flooding, and the patient start to recover. Here, this patient was not on the ventilator support. He is only on the high nasal flow oxygen supplement. So, and on discharge, you can clearly see patient, the whole lung was involved in the fibrosis and some kind of flooding, and 1 month after discharge, the patient recovered quite well. So case 2, the patients with fever and desaturation, this foreign, this patient actually is from Egypt. So what we give to reduce the fever is we use a ginseng formula to give the patient, and patient's fever gone. And we use a transdermal therapy to improve desaturation and and suppress cough. So initially the patient was the SpO2 only 90%, but after the ginseng formula and transdermal therapy, the patient's SpO2 recovered to 96% on the room air. So patients recover quite well and quite quick. And also very interesting is this is a very severe patients actually. Here he is in this year. So in Shijiazhuang, Hebei province, we have another rebound of the COVID-19 in that city. So he was a 70-year-old male. He had a baseline hypertension, and on the day 7, the patient's fever increases from the 37.8% to 39.5 again. So he started to have coughing, shortness of breath, desaturation, and he had a bilateral lung infiltrate. So actually the physicians, bedside physicians plan to transfer patient to the ICU next day. And after we gave the ginseng, and especially we double the dose of ginseng, the patients start to have shiver. And after the shivering, the patients recovered from the COVID-19. So it's very strange. So actually, in Chinese medicine, we really documented that after this kind of shivering, the patients can recover, and basically they expel the viral from the body. Let's do some summary. So this is the typical pathophysiology of the COVID-19 triggered ARDS. So the left side, you can see this is normal alveolar. The right side is an injured alveolar during the acute phase. So what happens to the alveolar level? So the alveolar start to get flooding and start to have the membrane broken, and the oxygen cannot penetrate the alveolar and go to the blood circulation. So this is a very important stage. So So right now we don't have any good method to treat this alveolar flooding. So these are several things. The first, we need to prevent the patient's the membrane broken. But once the membrane broken and start to develop alveolar flooding, then you need to reduce the alveolar flooding. So the respiratory support, mechanical ventilation, they certainly can help you to protect your lung and to protect your alveolar flooding. But using Chinese medicine, the is a very early stage, like within the 48 hours, once you get the COVID-19, you need to use the ginseng to prevent your the viral triggered you cytokine storm and to stop the cytokine storm, so then the patient will not develop acute lung injury, especially for this vulnerable population. So what we once the patient really have some kind of alveolar flooding, we usually use transdermal therapy and to reduce this flooding and to make this alveolar level back to the normal. So that's how we do the basic weapons for the TCM practitioner to treat COVID-19. I think the ginseng is the most important part. Here is regarding the modern pharmacology research. We can clearly see ginseng have different functions, and it can regulate our human immune response, not only the innate immune response, but also adaptive immune response to help you to adapt to this new virus. Certainly, the transdermal therapy is also very useful to reduce the alveolar level flooding. Summary. So the most important part is to identify the high-risk population, and these patients who have baseline conditions, who have Qi deficiency according to Chinese medicine, you need to protect those population. And second is early use of ginseng and ginseng formula, so to reduce the fever, to reduce the possibility to develop acute lung injury for vulnerable population. So the third, once they really develop acute lung injury at an early stage, then we need to do the transdermal therapy as early as possible to treat alveolar flooding. Certainly, if all this did not work, then you need to do some intubation backup for critically ill patients. Thank you. So if you have any questions, I would like to take, and thanks for your notice, and thanks for any questions, and I would like to answer. Thank you.